Today we will be discussing one very important topic, that is short stature or height problems in children. Because many parents are worried about their children's height, so I thought we must discuss on this important topic. So what are the common things or the complaints which parents come with? So many times they feel that when compared to the friends group or the children in the same class, the child is not growing as per the other children. And second being, when they mark the height of the children in their house, they see that there is not much change in the height happening. Third thing, they may feel that the same clothes are fitting the child for 6 months, 1 year or 2 years altogether, and he's not outgrowing his clothes. So these are the things when parents feel that there might be some problem in their child's height. What is the role of the pediatrician? So if you find any of these issues in your child, you must immediately approach your pediatrician or pediatric endocrinologist. And what is done in the doctor's office is, so first thing, they would take a very detailed history of the child, like what was his birth details, what was the birth weight of the child, and then the other details, like if the child has had any previous medical problems, like any hospital admissions. Then they would also ask you about the family history, like how was the height gain pattern of the parents, of the siblings, are there any one in the family a very small or a very short height, and any other similar concerns in the family. And then they will plot the child's growth on the growth charts. So there are separate growth charts for boys and girls, and the pediatrician will measure the height and weight and plot on the growth chart. And if you have your old height records of the child, so please take them to the doctor's office, because it gives much more information, like how the child has been growing all throughout. So after taking all these details and after measuring the child's height, after examining the child properly, so the doctor arrives at probable reasons for the height issue, and he may advise for some tests. It may include blood test as well as one x-ray of the left hand, which is called as the bone age x-ray. These both give very crucial information as to what could be the reasons behind the height issues of a child. So we come to discuss about the common reasons why a child's height may be affected. So I would say 90% of the times there may not be any serious problem at all. So the two common issues in this, one is called as the familial short stature, so wherein if both the parents or the grandparents, but mostly the parents, if they are of an average height, the child may have a tendency to grow in the same height range. This is called as familial short stature. The second being constitutional delay in growth and puberty. So what is this condition is, the child in the initial years may continue to be on the shorter side, but he will keep growing as per his growth curves, and when his friends attain their maximum height, the child still is continuing to grow. So for example, this child with constitutional delay in growth and puberty may attain their height a little later, like 2 or 3 years later, but they will achieve their final height well. So these two are the most commonest reasons, and they usually do not demand any treatment. Now less than 10% of the times there may be an actual problem. It could be a medical problem, it could be a hormonal problem, it could be a genetic problem. So medical problems, like if the child has any other issues of the organs like heart, liver, kidneys, so that can affect the height. The third, if there are any hormonal issues, for example thyroid problem or something called the growth hormone deficiency, the child may have height issues. And third, there are some genetic problems like genetic conditions wherein a child's height may be affected. So when you come to your doctor's office, the doctor will analyze all this information and provide you with the appropriate treatment. If the child requires any growth hormone treatment, you will be offered the treatment on that and the entire information. So if you notice any such height issues in your child, you can approach your pediatric endocrinologist, and here at Ankura we have all the facilities available for the testing as well as the pediatric support staff to ensure a proper growth on your child. Thank you.